Okay, so welcome everybody. We'll make a start. As you know, a few of us here today, most of you have been before. It's quite an informal meeting. It's just update any developments in your organisation and share any news that might help the group. So it's very quick introductions. Just so, because I know perhaps it's Zena's first time of joining us. Zena, would you like we'll just go around the room and start with Zena, as I know it's your first meeting. Just like to introduce yourself.
Yeah, no, thank you. I'm Zena Dalton. I'm the Chief Exec at Forest Citizens Advice.
Lovely, thank you, Zena. And I'll go around. I've got Claire next.
Hi, I'm Claire Arthur. I'm the Macmillan Information Support Services Lead for South Worcestershire, so they're covering Worcestershire Royal.
Lovely, thank you, Claire. Ben?
Morning, everyone. Ben Furlow, Living with and Beyond Cancer Programme Manager at Ulster Acute.
Okay, lovely. Rachel?
Hi, Rachel at the Hereford Cancer Information and Support Centre.
Thank you. And got Lisa W, not Lisa Jane. We'll go Lisa W first.
Good morning, I'm Lisa Watts. So I'm from Primrose Hospice in Bromsgrove. I'm the Family Support, Counselling and Benefits Lead.
Lovely, thank you, Lisa. Anne and Rendell.
Hello, everyone. Sorry I was a few minutes late there. It's Anne Renzel and I'm at Kemp Hospice.
Lovely, welcome. And Sharon?
Hi, I'm Sharon Johnson, Cancer Care Coordinator for Worcester City Primary Care Network.
Lovely, thank you. And Lisa Jane?
Hello, yeah, Lisa Jane, Macmillan Caseworker Advisor within Forest Citizens Advice for North Worcestershire. And apologies, I can't seem to get my video working.
Okay, lovely, thank you, Lisa Jane. Well, yes, you know me, I'm Sonia Gregory, the Advice Services Manager at Worcester and Hereford Citizens Advice. So, lovely. So, I think. Shall I just start with a little bit of an update, what's happening with the Macmillan Welfare Benefits Service? A lot of you I've written to, but we haven't got the actual final details yet, but we have got contracts that are being looked at and ready for signature, and it's all progressing. So yeah, I mean, basically, for those of you who are not aware, that the history, many years Macmillan have funded welfare benefits advice service for cancer patients. So midway through last year, we were told by Macmillan that the funding was not sustainable and the service was going to end at the end of May 26, so just coming up now. Towards the end of 25, they did a U-turn. I think they must have had quite a bad backlash from, they had some bad press, and they have found 3 years interim funding to keep the service going, but it has been remodeled, and it won't be the same as it was, as it has been running. It's the end user, patients or clients, they will have the same service in terms of what their goals and aims, what they want to achieve. But it is now going to be a regional service. So our area will be in the Midlands. It's a Midlands region, which is being led by Coventry Citizens Advice. And Macmillan are funding Coventry to lead the region, and then funding various services in the main Citizens Advice, but some councils as well. So that includes Worcester and Hereford Citizens Advice, it includes Forest, and they will be independently funded with a subcontract from Coventry. Now, the biggest change is that Coventry will run a central triage service. So the point of referral will be Coventry. So you will refer your your clients, your patients to Coventry Citizens Advice, who will then conduct a triage and see what best help the client needs. They might be able to help at that point of entry, so they might be able to give some signposting if the client, is able to use signposting. They might be able to do some very basic advice, like a benefit check or some benefit queries there. But if it's more complicated, in much the same way as now, the triage team will then refer on to the local caseworkers. So your patient or client will be referred on to our advisors in our local offices. Because it's a central team, it does give a little bit more flexibility. So if the triage team will look at where there is availability of an advisor. We'll try and keep the patient with the local office, but for example, if it's a telephone interview, an attendance allowance application that's SR1, fairly straightforward, they might speak to a caseworker around the region if their local office hasn't got capacity that week. So there's a little bit more flexibility. They've created this model because they want to try and make sure that the reach of the service is extended. So they've looked at the level of cancer incidence, the level of indices of deprivation, and they've tried to do a model where they think how could they reach more cancer patients than they've been reaching before. So it's all new, and so the actual process, for example, they haven't issued a referral form yet, a phone number, all of that kind of thing. So over the next week or two, obviously, we'll be letting you have information that how you will actually go about referring your patients or clients to our team. I was just going to say, Zena, do you think if I sort of summarised it, or did you want to add anything to that I've missed?
No, I think that was well summarised, Sonia. I think it is just a case of it is going to be a central hub for the West Midlands, for the Midlands region, and they'll triage. And if a client or a patient is from the Wyre Forest or the north of Worcestershire, then most likely they will come to our office for casework. But as you say, if we haven't got capacity, then there's an option to use other offices if that's the best pathway for the patient or the client. So yeah, well summarised, I think, Sonia.
Yeah, and I think what we'll need to bear in mind is it's going to be evolving, because they're going to have to tweak it because it's brand new. The triage team will be brand new. We don't know how many of our referrals will find the triage team quick. I mean, obviously, we're going to try and notify our regular users, but people, for example, that self-refer, things like that, we don't know if there'll be a little bit of a dip in people finding the service for a little while. So I think there's going to be, Coventry are going to need to do a little bit of liaison and promotion of the new route into the service as well. So obviously, when I've got all the details, I'll share with this group and spread the word as much as you can, so that we can get, for example, in the information hubs, if people are not referred by member of staff, if we can have details of the self-referral route up there and things like that. So yeah, okay.
I think it's worth saying though, Sonia, isn't it? There's never a wrong door. So the client will get seen, won't they? If they come through the wrong door, we'll direct them to the right door. So
absolutely,
it might be a dip, but it's not a case of the service is not there. We'll work through it.
Yeah, it's just going to be those early weeks, just making sure, helping people to find us, isn't it? Yeah. So that's it. And our advisors at the end of the referral chain, will be the same, well qualified in the same way as they have been before, working out of the local offices. So they have the local knowledge still as well. And apart from the odd one that might be referred elsewhere through capacity, and then there'll be the liaison and networking between offices to, if they're not sure what is available in the local office. So yeah. Does that raise any questions, folks? Anybody?
Sorry, so the Macmillan hubs, like sort of the Worcester and the Alex, are they still going to be there, are they?
Yes,
Yeah, that's brilliant.
we're still here. We'll
Ah,
still be referring him, but using a different pathway. So yeah.
Yeah.
Thank you.
So this remodelling will be is purely for the benefits service. So, for example, Claire with at the hub will be contacting this new Coventry triage team. So if somebody is going through Claire's team, they would Claire's route in will be the triage team. Yeah. So
Sonia, can I just ask what impact that has on your team, the advisors? I know, in terms of how your team's actually going to look as a local team.
Yeah. So we're going through a process of we've just been told how much funding Coventry have offered us as a subcontract, if you like, and that is sufficient to maintain our advisors, our caseworkers.
Right, great.
What is changing is the case support workers. That role is unfortunately at risk of redundancy. We haven't finalised all of that yet, because the triage team will be doing that work. So they are welcome to apply for the triage role at Coventry, because it's a remote role, it's a phone role, but they are looking for slightly a bit more advice experience in the triage team, because they want that triage team to be able to take on some basic inquiries rather than so that the caseworkers are looking at the more complicated things. But we're going through that process at the moment. But the advice role, the advisors themselves, that role is not at risk of redundancy. But yeah, we're having to look at the case support workers at the moment. Yeah. So I mean, they're all going through the process. They've all been kept, fully up to speed with what's going on. Yeah.
Okay, thanks, Sonia. A lot of change.
Yeah, absolutely. Yeah. I think, basically the regional model, when they look at the area it covered and the total head count that's being lost, for want of a better word, for the funding, because of the funding reduction. So yeah, the new regional model, Macmillan, providing less funding than the old model. I think the headcount reduction across the central region was something like 12, but it's a massive region. It goes up to Telford and the Wrekin, it goes up to Shropshire, it goes out to Warwickshire, and it's East and West Midlands. So yeah, so that's a difference. They're trying to make efficiencies by having this central triage team, really. Yeah. So, Rachel, you've got a hand raised.
Yeah, so I guess I've been made aware that we work in a very privileged way, in that we work really I work really closely with the Hereford Macmillan cab team. And one of the things that we noted on the contract that we're still going through is that it says, and the question we asked, or Annabelle asked, is, so what feedback will we get about the care and support that our patients have received? And can't remember his name, Matt from Coventry said, well, none. We disagree with that, because on a daily basis, weekly basis, there might be an update given. They phone us to ask where the patient is, because they might be in hospital on a ward at the time when they're trying to contact them. Often they're asking, has that patient is deceased, because you get hold of them. They notify me sometimes before I know, vice versa. And so I'm just wondering what it will look like when it comes to actually, having
so once
patient care and knowing where our referral goes to. And
no, I mean, at the initial point of entry, when there's triage process going on. For example, it's trying to establish if the client's got an SL1 certificate, then a triage team should be liaising with the local hospital or whatever to try and find out. So they will need to have your contact details. I don't see how they can avoid that. Once it's through to the caseworker, then there's got to be that our local caseworkers, so in Hereford, Vicky and Ruth, and Joe, the support worker, yes, they regularly ring you to perhaps get an update on the patient. And I don't see how once the caseworker's actually opened a case and is doing the casework, I see that needs to continue. I mean, the only difficulty might be if a case has been referred to out of the local area because of capacity. But I think they will generally try and keep those to perhaps, the slightly more straightforward queries, like if the client only needs an SL1 or a blue badge or something like that. But yeah, it's gonna have to be evolved, and I think Coventry will realise that once we start, there's a lot more liaison needed between, the health practitioners, the information hubs, then perhaps they realised, and it's going to be developing and feeding back, and I could still be your point of contact, to say, look, this isn't working with Coventry, and I can take that forward. So yeah, we'll have to take feedback and improve as we go along, I think. So yeah, Sina, have we got any take on that? Would that sort of sound your a vision of how we got to? It's sort of all a bit unknown still, isn't it?
It's a little bit unknown, but when we've been speaking to Matt, who's the chief exec at Coventry, and we've been speaking to Ed, who's the project lead, it's very much a case of it's being done with us and involving us. It's not being done to us. So I do get the sense that it's all unknown territory. We've done lots of project planning, haven't we, Sonia? I know you've been on a lot of sessions talking about how it will work in the future. And I think it is one of those cases where they will take on any kind of advice or what we say has gone well and what we say hasn't gone so well. I'm sure they'll work with us to get the best for the patient and the client, because that's what they want to. So it's just trying to work together, really, isn't it?
Yeah, I think they've been from the start of the project. They've said, took part in a few. They wanted to be a collaborative design of a service, and obviously because it is brand new, we went to a lot of project meetings to help design for the triage role, and we've given them feedback about local knowledge and things like that. But it's very much when the triage team start getting the referrals, they'll start to understand exactly what gaps need to be filled in. Yeah, but to get the client where they need to be, really. Yeah. Yes. Okay. Yeah. So that's sort of my update, which obviously is quite a big update. And soon as we've got the actual process, this is how you contact them, this is the form you'll need to use, then I'll get it round to this group as quickly as possible. So okay, so let's just go around on my screen. So Claire, what news from your service?
Probably the biggest news is that we've had 2 new support workers who started in January. So we've been trying to sort of get them up to speed, really. So we've got Sasha in North Worcestershire Hub, who is our support worker supporting Ange and everybody. And we have Katie Parker in our South Hub. So they're kind of, as I say, been getting up to speed and settling in. So it's been nice to have them on board. I'd say the service in itself, the footfall has been a bit slower recently, not quite sure why. but it has. But actually, that's been quite helpful because as you can imagine, it's quite full on when you've got another person that you're trying to inject all the time as well. But yeah, so that's really great. We're enjoying having them, and they're starting to be a little bit more independent. I don't think there's any major changes in terms of the hubs. Obviously, we're still getting the H&As. I know that Ben will talk about Hope, so I won't talk about Hope. We had the Macmillan conference a couple of weeks ago. That was really good. That was held in Birmingham, so that was a really good event with some brilliant speakers. So, with some really sort of great information shared on health, nutrition, and so forth. We're going to be looking at how we can utilise some of their information, perhaps in Worcestershire. So that was great. But in terms of our service, we're still going forward. Totally relieved to know that our CAB service is still there, and Andrew and your team are still there, which is a massive relief. We seem to be doing blue badges are coming out of our ears. That's one thing that is just increasing and increasing. Yeah, but that's fine. That's absolutely fine. So yeah, I don't think there's anything else to add particularly, really, from me. You know what I do. You know what we do. So I won't bother about that.
Oh, thank you, Claire. That's great. So next, I've got Ben on the screen next after that. Ben, would you?
Yeah, well, just to follow on from what Claire said, very lucky to have new support workers in the hubs, which is great. Hope courses, obviously, that we deliver are going from strength to strength. We're very lucky to have a lot of facilitators with us. So just doing evaluation actually for the ICB. So our plan for this year is I think we've done 4 already this year, Hope courses. So we do obviously the 6-week course and the take control course. So we do prostate, breast, heme, and we're trying to do some patient videos around that. I had a patient contact us yesterday who's very keen to do a patient video about the benefits of Hope. So we're really we've got a bit of a waiting list, which is great to have. But I think if you come across any patients that, I know obviously you're supporting from a financial element, but if they're struggling with other things and Hope is something that you think would benefit them, then we've developed a referral form so you can fill that in, and then I can contact the patients and speak to them about whether Hope would be useful for them. So I'll happily share that with the group as well. But yeah, I think that's it really. There's not a lot. I said there's not a lot else going on. There's loads going on, but I think just for the gallery, yeah, I don't want to sit here all day talking about other stuff. So yeah, that's it from me. Thank you.
Yeah. Okay, lovely. Thank you, Ben. That's lovely. Anne Rendo, that one there.
Thank you, Sonia. I think the big news from this end for me really is that there is a new referral form for the Finance and Welfare Service at Kemp here now. And it's been decided that I can no longer have any access at all to any medical information for my clients. So it's really I'm trying lots of workarounds, and actually the referrals that come in, particularly from Sasha and Angela, they've been absolutely brilliant. They are arranging for the SR1s to be sent rather than via me to Department of Work and Pensions, doing that by the medical professionals direct. It does slow things down tremendously, and of course I've got no control and no knowledge about whether SR1s have gone or not. So there's a lot of chasing around, but I'm doing workarounds. So that's just, I don't, it is a need. I need that information, but I can't look at it directly myself anymore because of the change of policy.
Just makes your job just that little bit difficult, chasing up things all the time then, yeah.
Well, I just want to make sure that, that the patients and clients get the holistic service that we've aspired to in the past, and it's work in progress at the moment. So I'm trying lots of workarounds.
Right, lovely. Thank you, Anne. Right. Sharon, who's got any updates?
Listen, I'm not racist.
Hi, sorry, I've not been on these for probably about 6, 12 months. So, well, we're still working in cancer prevention. So, of course, I work for all the Worcester City GPs in Worcester City. We are looking at, the prevention side of things primarily, but also I'm going into patient support. It's still really getting off the ground. We're not promoting the service well, particularly. So we're looking into how we can do that. Working closely with Katie and Claire as well, or I have been. As I said, it's not really got off the ground yet, but it will all be signposted. So, a lot of what I'm signposting to will be to Macmillan. So it's really useful that I'm on this call today. Yeah, we did a lung event to raise awareness of lung cancer, particularly for non-smokers. Women are the most likely to get that as a non-smoker, never smoker. So we did an event at the Guildhall back in March, which was really successful. People really enjoyed having the chance to get their lungs checked, a health check on their lungs. There were nurses there from oncology to talk about, the clinical side of things. We're also promoting our other services at the same time and giving away these marvelous jute bags that we created. So, it was a really positive experience, because not all community events are positive, but this was. I think we chose the right location at the right time of year, and we just hit it right, really. We got a lot of good engagement. So yeah, it's all good. Thank you. That's it from me.
Thank you, Sharon. That's great. Okay, Alan, you're next on my screen.
Hi, everybody. Yeah, it's been a while since I've been on this call
Yeah,
as well. I
good
can't
to
remember
see
the
you.
last
Yeah.
time. So I don't know, like in terms of updates for me then, so there's a few things to mention. So as you know, that for people who don't know me, that I work for the ICB, but I'm in a Macmillan funded project, a health inequalities project, which has been going now for over 2 years, and we've been working with ethnic minorities, and particularly the Pakistani Bangladeshi community in Redditch, and the Romani Gypsy traveller communities across Worcestershire and Herefordshire to an extent. So just round about Christmas time, we worked with our Pakistani women's group to develop a community cancer champions training. That ended up being sort of 2 levels. The first level was about raising awareness of cancer, signs, symptoms, screening, basically trying to normalise cancer conversations. And then we developed a level 2 training, which was about that same cohort of 15 Pakistani women being able to sort of deliver, if you like, practical and emotional support for people living with cancer. So the first part was more about awareness raising in the community. The second one is more about being able to support people. So that's where we are with that champions training. In terms of the Gypsy Roma traveller community, we're now working with a woman called Abby Smith, who has started up a GRT-led community organisation, and they're delivering awareness training so that organisations can get more sort of appreciation of the challenges and issues that people from a traveller background face. So at the moment, I'm trying to work with Ben and Claire and Ange up in Redditch to get some community, some GRT awareness training. So just I could flag that one up if that's something that people on this group might be interested in. We could explore that, and I can pick that up after the meeting. The other 2 things to mention from this project's perspective is there's been some changes at the ICB. So I'm a part-time worker, and the other half of this role was covering Herefordshire. She's left under voluntary redundancy, as has my project manager. So I'm all that's left of the Macmillan funded project, and there's about 9 months left to run. And the other thing that's kind of affected the project at the moment is that the ICB have commissioned a community cancer champions project very similar to the level 1 champions that we're delivering, so that it would be about raising awareness, normalising conversations, encouraging people to go along to screening. So that kind of, I think I don't want to end up competing for the same kind of groups. Essentially, they are much wider. They're not so focused on particular ethnic minorities, but if they get the, basically the champions work that I've been doing, I think will have to be refocused into something else. So I'm flagging that up as well in case anybody's got any ideas for an engagement role linked to cancer, health, and equalities. So yeah, I think that's everything. And I was at the Macmillan conference last week as well. So yeah, it was really good.
Great. Thank you very much, Anne. It's good to see you again. Yeah. Lisa Jane, sort of as a caseworker, have you got any news of what you're seeing, what's going on there?
Hello. Yeah. So me and myself and Teresa will be leaving come the end of this current contract onto pastures new, but we're recruiting for that role as we speak. So hopefully there'll just be a very, sort of good transition to the new caseworker. So that's good news. So yeah, what we're finding, a lot of the PIP reviews are coming up, and a lot of people are losing their award. So that's keeping us busy with challenging the PIP reviews. It's been quite startling how people from, sort of enhanced can suddenly get 0 points. So I think that'll be the challenge going forward, the PIP changes. But other than that, yeah, we're just carrying on as we're going, really. Yeah.
Yeah. Oh, lovely. Thank you, Lisa. That's great. And the other Lisa, anything to report? Where you're?
Hello. No, actually, nothing really to report from Primrose. I suppose with the benefit side, it's just very up and down. We're quiet at the moment, but then all of a sudden we can have an influx of referrals from. So yeah, but at the moment we're just sort of in a quiet period at the moment. But other than that, yeah, no, nothing else to update. Thank you.
Okay, jolly good. Rachel in Hereford, what's going on? Any news from the hospital there?
Yeah, mostly business as usual. I have to say that I agree with Claire. It's been slightly quieter, which hasn't been a bad thing because I've been able to breathe and catch up with myself a bit more, and not feel like I'm just fighting fires. But yeah, it's just been a little bit quieter. Always a steady stream with finance, always.
Yeah.
And blue badges and things. I don't do the blue badge because I just don't have the capacity to, unless it's an SR1, then I can do it.
Yeah.
But yeah, just slightly quieter. What I'm trying, we started the take control courses. We've decided that the take control is the best one for us because people have to travel in for such distances for Hereford. We've identified a really lovely venue that's in centrally to Hereford, and we negotiated with our Oncology Trust Fund to include the parking, so that's helped. And we had a really successful first one. We're running it bi-monthly. And then the second one, we had really good numbers, and then just genuine reasons within the day, they dipped out, illnesses, sicknesses, sort of fatigue, all those things. So we postponed that one. We've got a good number coming up for June, so we'll hopefully carry on as normal. And then the other thing I'm looking into, because the longer we go without support workers, we have a part-time support worker in urology, we have a part-time support worker in skin. They work really well with their teams closely, but I've noticed significantly that, and there's no finger pointing because it's capacity of the clinical nurse teams, but the longer we go without support workers, the wider the gap is becoming for holistic support, in my opinion, because it's the awareness that there can be holistic support. If they're not coming through the MRU, or they just not aware of the services. So I've got to work hard on promoting constantly, but at the same time always dealing with a knee-jerk reaction to things, and I don't want to do that. So I've had quite a really good sit down face-to-face candid conversation. We don't have a rep coming to us. We haven't since we lost Sharon Chadwick and Helen English, but we got Emily coming, and we just had a really candid conversation. This is us, warts and all. So don't expect us to be able to fulfill an H&A for every patient. So how can you work with us to make it happen? They really took it on board. So they're going away and they are going to look at how they can engage more with making their H&As work with our systems, so that I can then go back to the CNS teams and saying, if we make it as simple as this, are you prepared to do it a little bit more, really? So that's there's no finger pointing. It's just what it is. Our capacity is stretched across the board.
Rachel, did you see Anne's question?
I haven't seen any chat.
What is a take control event?
So the take control is, so there's the Hope courses. They can run. Ben's much more averse to this, that they can run for six weeks, or the slightly shortened program of across 2 weeks. We tried it when we had support workers a couple of years ago, and it's just that very thought of, some people will be coming in from Powys. Some people, I mean, the journey is huge for some people. Our public transport system is pretty shocking. So we've decided that it's the take control one. I think it's fairly new, Ben, isn't it? That it hasn't been running for that long, and it means that one person can go get a bite size of everything, and that's it then.
Yeah, so it's I call it Hope Light. So it touches on everything within Hope, but it's over a much shorter time period. Rachel, I don't know how long your sessions are, but I tried to do it for within 3 hours. I think that was far too short, because we set them up to be tumor specific, because obviously we're fortunate that we can run the big 6-week courses, but we do take control for directly at prostate patients. We've done one for heme. Claire, you're doing one for breast, aren't you, coming up?
Yeah.
So we use take control to be tumor specific. As Rachel said, you've run it over 1 day, so it's easier, especially if you've got things like transport issues. It's easier because you're just coming in one hit, as it were, rather than 6. How long are you running your sessions for, Rachel?
We unashamedly copy yours from start to finish.
Fine.
We started at 10 and we finished at 3.
Yeah,
and
perfect.
it incorporates all the things, because we learned from you in that I think it was Ange and who said that when I initially had a sounding out from you guys about how you did it, that we incorporated those 2 extra modules, so the mindfulness and the communications one. So we've incorporated all of that, and it really worked. It really
Good.
worked.
Well done.
But we can't do it site specific just because of the
Sure.
numbers in the cohort, but
Sure.
we still had a really engaging conversation in the room from all sides.
Yeah, brilliant. It's really good you're able to get something off the ground and offer it to patients. So yeah, well done.
That's great, Rachel. I guess that's the thing with Herefordshire, isn't it? It's the same as our service. We have to go out, find little village outreach locations to community halls, and So is there any prospect of support workers, or what's going on in Hereford?
No, is the bottom line.
That's the answer, right? Okay.
In the defence of management, Annabelle, she is on board. We both know we need one. It's a single point of failure. When I'm not here, it closes, and it's as simple as that. There's nothing we can do about it, and I do need to go out a lot more. Obviously, it's that chicken and egg, because as the more services we lose, the more I've got to go out and find it in other guises, and so I need to do a lot of networking, which is fallen, and go to these, go to the conference. I just can't, because that's 2 days with the centre closed. I quite like my annual leave as well, so it's just, I could really do with somebody. They know that. It's just there is a freeze on all headcount at Wye Valley Trust. And if there is a role that comes up, it's generally internal, and there's just because these were fixed term posts, we can't convince anybody to make them a permanent post at the moment.
Yeah. Oh, that's a shame, Rachel. But yeah, well done for keeping going.
Yeah.
Yeah. Right. So I think we've been around. Zena, have you got anything to add, Wild Forest, or anything you're seeing there?
No, I don't think so. I think we've covered it really. Just saying
Yeah.
working through the new service, signing contracts, and also just to say thank you to Lisa Jane and Teresa for all the hard work they've given the Macmillan contract whilst it's been with yourselves. And I wish them the best when they move on. And as I say, we've got the Macmillan caseworker slash wellbeing team, welfare and benefits team leader position out to advert at the moment.
Okay, okay, thank you, Zena. So yeah, I think that probably everybody's updates. I will share the recording as normal. Lynn Yendor sent me, I've sent her apologies, but I'm going to share her Walking for Health schedule, which might be useful for some of your clients. And if any of you want me to share anything with when I send out the link for the recording, just let me know and I can add that.
I'm so sorry to go back around to the beginning again, but I know you sent an email saying how up until the wire, the dates wise, can we continue to refer into our local team for up to you?
Yeah, so at the moment, they haven't confirmed when they want us to stop, but we're not gonna, whichever way it goes. Yeah, I've got a meeting. I think each local office is going to decide according to capacity. So I'm gonna have a meeting and also speak to the project manager when, what will be their capacity to take on referrals from the first day. And also, if we keep on taking referrals, for example, the last 2 weeks of May, will that be carried forward under our obligations in the new contract? Because there's no point taking on a casework the week before the old contract finishes if the caseworker is not supposed to carry on with that client. I can't see that being the case. But yeah, I'll ask questions this week and finalise exactly whether we can go right up to the end and just transfer, or yeah, I'll clarify. I thought that you.
Sonia, my understanding is that any clients or patients who are in the service now just roll on into the new contract.
So I asked because Grant went to the chief officers meeting. I asked him to clarify that. One thing or another, I haven't had a meeting with Grant for last week. Yes, I mean that makes sense. I mean, if it just rolls over, we wouldn't need to hold referrals at all, really. Yeah. But yeah, when we get, because they should be contacting us, I assume, with the actual process, and we'll just confirm that as well. But it shouldn't be an issue because it's just going to be clients that need to see us, isn't it? Or hear from us. So yeah, okay, good.
Sonia, I had a quick question.
Yeah.
For Rachel. So Rachel, I may already know the answer to this, given that you were saying about staffing and stuff like that. But I mentioned that I'm hoping to deliver some sort of Gypsy Romany traveller awareness training to the information centres in Redditch and Worcester hospitals. And just wondered if you were interested, because strictly speaking, my remit does cover Herefordshire for, especially with the traveller communities. So there may be yourself, and I don't know what other, if you've got volunteers. I know you're saying you don't have support workers, or if there may be other staff that might be interested. Essentially, it's delivered by a woman from a Gypsy Roma background, and it's about, as I said, raising awareness of the issues that people face, and we're hoping to have some sort of, what would you say, it's not accreditation, but like a sticker or something that you can maybe put up saying we've done this training, which the people would see the sort of Gypsy Roma traveller flag.
So what does it look like? Is it face to face? How many hours?
Yeah, it'd be face to face and probably about 2.5 hours. And we'll pay for it as well. It does come with a cost, but it can come out of the Macmillan budget that we've got.
And you could come to us, could you?
Yeah.
So it potentially very much interested, and it could be myself and the two part-time support workers in skin and urology. So yeah, I mean, have you got the my email address?
Yeah, I'll get it from the. I should be able. And maybe I
Yeah.
don't. If you can put it in the chat, that would be great, and I'll ping you an email.
Yeah,
I'll give you
I
an
can make sure
outline of
you.
what we're doing.
Yeah, that's
Brilliant.
it.
The same applies to the whole group, Sonia. If anybody can think of anybody that might benefit from this,
Yeah.
as I said, we can cover the cost because it's kind of within scope for this project, and yeah.
Okay, lovely. Now I'll make sure that when I circulate the link, you've all got each other's emails. That's fine. Yeah. Okay.
Brilliant.
Right. Well, thank you all very much. I'll we sort of going for 4 monthly, weren't we? So we're in May, July, August. Yeah, we'll be September when we next just have a catch up. So yeah, I'll look at probably the second week of September and send you an invite on a date just a little bit close to the time. Yeah. All right, everybody. Good to see you and take care. Yeah. All right.
Thank you.
All.
Thank you.